Hello, welcome to Sonography-radiology training channel. This series of videos is about basic radiology learning for beginners and non-radiologists. This is the second video in this video series with title of Familiarity with Imaging Modalities Part 2. These items were explained in video part 1. Now, in video part 2, I will explain the familiarity with two other imaging modalities, include ultrasound and MRI. The first one is ultrasound. Ultrasound probes use acoustic energy above the audible frequency of humans to produce images. The audible frequency of humans is between 2 and 20,000 Hz, and ultrasound probes produce the waves over 20,000 Hz. They produce these waves instead of using ionizing radiation as both conventional radiography and CT scans do, as it was explained in video part 1. An ultrasound probe or transducer both produces the ultrasonic signal which encounters the object and records the rejectable waves from the object, as you can see in this clip. The signal is processed for its characteristics by an onboard computer. Ultrasound images are recorded digitally and are easily stored in a PACS system. Images are displayed either as static images or in the form of a movie, as you can see in this clip. Ultrasound scanners are relatively inexpensive compared with CT and MRI scanners. They are widely available and can be made portable to the point of being handled. Because ultrasound uses no ionizing radiation, it's particularly useful in imaging women of childbearing age and during pregnancy, and imaging children, like this lovely baby in my clinic. Ultrasound is widely used in medical imaging. It's usually the study of first choice in imaging the female pelvis, as we can see in this ultrasound image, the uterus and both ovaries, the bladder, and also other organs in the pelvic cavity. We can use ultrasound in differentiating cystic versus solid lesions in patients of all ages. As we can see in this image, a mass in the liver parenchyma and also a cyst in the liver. Also, we can use ultrasound in imaging of the fetus and placenta during pregnancy, and for performing real-time image-guided fluid aspiration, as we can aspirate by ultrasound-guided cyst in the breast, and biopsies, as we can see in this image, needle biopsy in a liver mass. Also, it can use in non-invasive vascular imaging, famous as color Doppler ultrasound imaging. Other common uses in the evaluation of cystic versus solid breast masses, thyroid nodules, as we can see here, a large thyroid nodule in the thyroid parenchyma. Also in the evaluation of muscular tendons, we can see here the patellar tendon in the knee, and also in the assessment of the brain, hip, and spine in newborns. Ultrasound is used anywhere from intraoperative scanning in the hospital surgical suite, as we can see here, ultrasound probe on the brain surface in the neurosurgery operating unit, or to the medical tent in the battlefield, and in location as remote as very cold regions like Antarctica. With the advancement of ultrasound devices, new capabilities have been added, like ultrasound elastography for measurement of the elasticity of soft tissue organs. For example, we can see here the image of liver elastography elastography for evaluation of liver fibrosis, 3D and 4D sonography, skin ultrasound. As we can see here, the skin surface, epidermal layer, subcutaneous fat layer, muscular fascia, and muscular layer. Ultrasound is generally considered to be a very safe imaging modality without any known major side effects when used at medically diagnostic levels. Now, familiarity with other imaging modality named MRI or magnetic resonance imaging. MRI utilizes the potential energy stored in the body's hydrogen atoms. The atoms are manipulated by very strong magnetic fields and radio frequency pulses to produce enough localizing and tissue-specific energy to allow highly sophisticated computer programs to generate 2D or 3D images. MRI scanners are not as widely available as CT scanners. They are expensive to acquire and require careful site construction to operate properly. In general, they also have a relatively high ongoing operating cost. However, they utilize no ionizing radiation and produce much higher contrast between different types of soft tissues than even CT scan. As we can see in this image, brain parenchyma, and also we can easily differentiate gray matter from white matter of the brain parenchyma. MRI is widely used in neurologic imaging and is particularly sensitive in imaging soft tissues such as muscles, tendons, and ligaments in musculoskeletal imaging. There are safety issues associated with the extremely strong magnetic fields of an MRI scanner, both for objects within the body, for example cardiac pacemakers, and for ferromagnetic projectiles in the MRI scanner environment, for example metal oxygen tanks in the room, which owing to the strength to the magnet can become airborne missiles. There are also known side effects from the radio frequency waves such scanners produce and possible adverse effects from some MRI contrast agents. As we can see in this image, side effects of gadolinium-based contrast dyes, for example headache, nausea, and dizziness. Now, please pay attention to this final teaching point. Ultrasound produces its images using the acoustic properties of tissue and does not use ionizing radiation. It's thus safe for use in pregnant women, children, and women of childbearing age. It's particularly useful in analyzing soft tissues and blood flow. Ultrasound units are less expensive and are in widespread use and have been produced as small as handheld devices. MRI produces its images based on the energy derived from hydrogen atoms placed in a very strong magnetic field and subjected to radio frequency pulsing. The data are analyzed by powerful computer algorithms to produce its images in any plane. MRI units are relatively expensive, require site construction for their placement, and are usually higher in cost to operate. They have become the cornerstone of neuroimaging and are of particular use in studying muscles, ligaments, and tendons in musculoskeletal imagings. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.